A lot of times I think people think, oh, everything's just supposed to do whatever it wants to do. I'll just sit back and sort of observe, but we actually want to keep the pelvic floor and core strong. I would say being a pelvic floor physical therapist is a great way to start because they're going to be able to individually assess you and then also prepare you for the role of the pelvic floor during labor and delivery.
Today, we have the pleasure of speaking with Dr. Tanya Goodrich, and she is a specialist. She is the person that we need to go to, an expert in pelvic health, and she's been offering her work for 15 years. She owns her own practice, and I'll let Ms. Goodrich or Dr. Goodrich share a little bit about what she does and how she advocates for women.
Thank you so much for having me on today. I am seriously so excited to be here and just kind of talk about all things pelvic health and women's health and prevention. It is my passion. And I'll just start right off the bat so I'm a pelvic physical therapist and I have been one for 15 years. It's basically a subspecialty of physical therapy that allows me to work in the pelvis with anything, as we like to say, TMI. So TMI, that means all things that you would never really want to talk about and I get to treat it. It's the best of the world. And I'm talking bladder, bowel, sexual dysfunction, all the sexy things. I'm talking hemorrhoids and constipation and leaking, really, really important things that kind of get brushed to the side sometimes or a little bit taboo topics that no one really wants to talk about. But prevention is key. And I have had Healthy Pelvis Physical Therapy now. We're in the Bay Area for 10 years and I've grown the practice and we have 2 locations. We also do telehealth, and we now have 4 pelvic physical therapists that work at the practice who are all doing the same things. And yeah, I'm just excited to kind of get into the weeds with this and answer any questions that you have.
So Dr. Goodrich, tell me a bit about the advocacy work. And I know that you're in the United States and the Bay Area is in the state of California and the telehealth portion as well.
Yeah, so advocacy. So really, pelvic health is everyone has a pelvis, right? Everyone deserves like adequate pelvic health service and not enough people know about it. I would actually say in a positive area, I do think that pelvic physical therapy used to be just a niche practice. And now I would say it's becoming a little more of a household name, which is super exciting. And essentially, pelvic PT is not sort of left out in the dark anymore. And personally, my mission is to eradicate shame and stigma surrounding pelvic floor conditions and treat it like you would any other part of the body. If you have a shoulder injury or a knee injury or a back injury, of course you get it treated. The same thing should apply to any sort of pelvic issue. And so in my personal advocacy, I have really become a pelvic floor speaker. And I also, part of my mission is to make it fun and funny and not dour and, oh, we can't talk about it. It's so serious, because we just need to bring light to it and be able to laugh about it so that we don't end up in adult diapers. I mean, that is the really, if I could scream it from the rooftop, I want everyone to live long, healthy, beautiful lives, and nobody should be suffering.
Important topic today. We're talking about women's health without shame, anything and everything that women feel that we often don't want to talk about. We're going to talk about it today. You're listening to Now Podcast, and my guest today is Dr. Goodrich. If you like the content of this podcast, please don't forget to follow. I am Yogi Patel, your host. And one of the things, how many women often feel embarrassed about things that happen, and we can't share this with anyone because we have shame attached to it. Well, today we're going to talk about a lot of topics that are really going to shed some insight. And I know that at my workout, where I work out, this topic came up. It really brought some insight, and that's how I met Dr. Goodrich, through a friend. Because when we're exercising and working out, I've noticed some women having to quickly make their way to the restroom. Are you one of those people who really have to run home from the grocery store, or you are just barely making it to the toilet? I think this is not something that just happens to you. I believe this is something that we all experience. However, we can't talk about it sometimes. So let's learn a little bit with Dr. Goodrich about what all of this is about and how we can sort of work on it together to have an improved quality of life without shame, without doubt, and not feeling isolated and alone. One of the things that I want to ask you, Dr. Goodrich, is leakage. Is this something that only happens to women who've had babies, or does this happen to any human being at any age?
I would say typically, right, there's two types of leaking that we need to break down. So there's the leaking that's called stress incontinence, and that's with like coughing, laughing, sneezing, running, jumping. And then there's a whole other type of leaking called urge incontinence. And that's the type where, oh my God, I got to get to the bathroom quick or I'm going to leak on the way. That's a different type. You can have one, you can have both, and that's called mixed incontinence. Now, the majority of women that have, let's say, even vaginal deliveries, stress incontinence can be quite common, right? And I use the words common and not normal because they've sort of just been normalized in our culture, right? Of course I leak. I've had 3 kids. This is exactly the type of conversation and changing the norms that I want to bring. That is not okay, right? I kind of like to make it funny, right? You'll see as we talk about this, if you can imagine a man, right, that had a tear in his penis and was just sent home, I don't believe they would just be like, okay, bye-bye, good luck. Like this is just what's happened to you, right? And it is just normalized into the conversation. So yes, that type of leaking, I would say, is more common, let's say in women that have had babies. Now, that other type of leaking that I mentioned, the urge incontinence, that can happen to anyone because that's a bladder system that has kind of gone haywire and it needs to be retrained. So the answer is sort of mixed.
Pelvic floor, right? We hear about that word quite often. And why is it so crucial, especially in women's health?
Pelvic floor, I would say, is a little bit of an enigma. Like, what exactly is it? Where is it? And what's going on with it? So the pelvic floor is the it's like a hammock set of muscles that attach from your pubic bone to your tailbone. You can imagine it's kind of the undercarriage of us. I like to refer to it as like our basement. And a fun fact is, why is it called the pelvic floor? And that's because it's the floor of your torso or of the core. So it's really just the bottom, right? And I like to say nobody likes a leaky basement. So that's the whole idea, is it's really the basement of the pelvis, and it's comprised of 3 set of muscles. And, if I had a pelvis right here to show you, the vagina and rectum are really close together. So it's a small real estate, which is why so many of bladder bowel things can kind of get interwoven because the real estate down there is just so small. So that's kind of the pelvic floor. It's that group of muscles that surround all of the viscera, the organs down below, and also attached to the spine and the pubis.
And what are some of the misconceptions about the pelvic floor?
Oh, again, one of my favorite questions ever. Because again, I feel like a lot of times in like, let's say biology class or human development, we don't really learn a lot about this topic. We don't learn about how often you should be peeing, bladder habits, bowel habits, how often you should be pooping, how to poop, right? So this is kind of again, because it's kind of embarrassing to talk about, but we're going to talk about it right here because we all have to do it.
When do you have to poop? When do you have to pee? That's fascinating to me.
Yes. So this is, again, if I could tell one thing to every woman, I always joke that every group, every mom friend group, or any women's friend group, really, there's always one person that has to know where all the bathrooms are, right? They have to go all the time. I have a small bladder is what I hear a lot. And guess what? It's actually not small. It was just trained to be small. And we like to call that jicking or just in case peeing, which is all out of whack. So now let's go back to the basics of what normal peeing is. So normal peeing is every 2 to 4 hours. Now that might scare some people out there when they hear that. They're like, oh, no way. I can't make it more than 45 minutes to an hour. And I drink lots of water, right? Now, the key to know is that when you pee, the pee length should be at least 12 seconds long. And I'm talking 1 Mississippi, 2 Mississippi. Okay. Then if it's like a 6-second pee, that's a false alarm. So what happens is when the bladder starts to fill up, it'll give you that first signal of I'm starting to go. And then a lot of people go then. And then it becomes a vicious cycle where it's like, oh, she loves to pee. When it's 30% full, we're going to let her know. And then here we go into this vicious cycle of just repeating the pattern. So the key is to kind of do 2 things. 1, count the length of your pee. And 2, jot down the time roughly that you peed. So for example, if you pee at 7 in the morning, just go, okay, keep it cool. I might get notified in 45 minutes that it's time to go. When you get that notification, just go, hey, you think you have to go because I trained you to go, but we're just going to ignore it, give it some time. And I promise you in about 10 minutes, it'll go away. Then you're going to very calmly and coolly walk to the bathroom. You don't want to panic bladder it, right? Because we don't want to get into that habit of that bladder just kind of freaking out. We want to keep it nice and cool. You walk calmly to the bathroom and then you relax and go. So I would say that's the first sort of misunderstanding of how often we should be peeing. I feel like sometimes in our culture, we hear, oh, you better go right away or you're going to get a urinary tract infection. You're going to get a UTI, which is not the case. We want a nice, healthy, normal bladder. So that's the first one, which is kind of exciting. And then just not to brag, but I can pee for like 29 seconds. So I'm just trying to let people know out there what you can sort of get to, because that really kind of blows people's minds sometimes, that it can really go, you can pee for that long. So that's my encouraging words out there, is that really it can be retrained. And then the next piece is also what I call power pushing. And that is, I go to the bathroom and I sort of strain and quickly get it out. That will resonate with a lot of people because we don't want to power push. It bears down. It puts a lot of pressure on our urethra and those beautiful pelvic muscles that I just talked about. But when you go to the bathroom, you want to relax and go. Take that moment of time and just really allow yourself to pee calmly. So that's another really important piece of information that I like to let people know. And then the other piece is really, if you're having any questions about all of this, like what is my pelvic floor? I've never really connected to it. Really reach out to, PT near you or reach out to us and we can really kind of help connect with you. It's not a scary appointment. It's very mellow. It's just a really nice way to help you connect to that area and make dysfunction get better.
Dr. Goodrich, you mentioned this thing that we do. We rush to the bathroom and we sort of get this bladder excited. This podcast is for many parents who are listening to it. We often train our children to have to go to the bathroom quickly. And I remember being a parent that said every time before we left the house, we would say, go to the bathroom because, we knew every restaurant bathroom or every supermarket where the bathrooms are located. Yes. And in different countries, we know, shopping malls. What are some of the ways now, let's say if we've gotten this habit, we have our children or ourselves in a moment where we're constantly looking for the restroom in order to not be ashamed by having an accident. Now, what can we do at home? Mm-hmm. I think some of it you did already bring up.
Yeah.
Train your bladder, but how training it from zero to where you need to go?
A lot of times I would say at home is a good place to start, right? Because the idea is you need confidence that it can start to happen. And it's a process, right? I'm not saying overnight, if you have to pee every 45 minutes, tomorrow you're going to be able to go 2 to 3 hours. So you need to start to train it. Now, in general, I was laughing when you were talking because jiffing, that just in case peeing, we often start to do to our kids and early on, getting them in that habit. Now, I will say every once in a while, it's totally fine, right? It's okay to do that if you're going to go on a road trip, let's say, right? We don't want to be stopping every 15 minutes. The problem is when it becomes a habit, when your bladder starts to rule you. And I want people's brain to rule their bladder. And that takes time and that takes confidence. So I mentioned it a little bit, but honestly, in a perfect world, you would just get evaluated by one of us, right? And if not, you can just start to train that bladder. And first of all, just knowing what correct is is super helpful. If you didn't know that the bladder could go 2 to 4 hours, just hearing that is really, really a great place to start. And then I would say ease into it. And then if you are somebody that leaks, if you are having that urgent incontinence, again, you qualify for pelvic floor physical therapy. So you should just sort of say, hey, I need this. And if not, allow yourself the ability to really go slowly and gentle with yourself as you train yourself and your bladder.
Now, this question is about new moms. We often have some challenges with pelvic floor. What are some of the challenges new mothers might face in terms of pelvic health?
Wow, this is a great one and very, very dear to my heart because pelvic physical therapy should be the standard of care for any way the baby comes out. If you think about it, being pregnant for almost a year is insane on our bodies. It completely changes our center of gravity, again, for almost a year. And then I like to joke that the baby either comes out the sunroof, hello C-section, or the door, right, vaginal delivery. And that, no matter what, is some amount of physical trauma. And I don't mean trauma in the emotional sense. I just mean that that baby has to come out one way. So I really want to get under the notion that treating that earlier and supporting a woman with her return to exercise and not just being sent out into the island alone. Good luck. You're good now. Exercise. In France, for example, it is the standard of care. They get 12 free pelvic visits because, of course, and again, sort of the French also don't have the puritanical background that we do. So, of course, we need to get back to having sex and it not being painful. And it's a part of our body that we don't want to have any dysfunction. So I really think that the US needs to level up their care and provide better maternal and postpartum care for women. And just like any other condition, the earlier we can treat it, the better, right? Because it's just happened. So it's much easier to solve. And even just, of course, like lifting a baby or a toddler. I mean, that's adding a lot of pressure to your pelvic floor. But learning how to do that even correctly is just you're leagues ahead later on down the road because now you're learning how to lift correctly after labor and delivery.
We really like listening to all the different aspects because sometimes we're not thinking of this, right? I would have never have connected pelvic health and after having a baby, all the symptoms and, you kind of always think, oh, it's just the hormones. It's just things that are happening to the body. But we don't talk about how to take care of ourselves. You talked about something very important, and Dr. Adler in Adlerian psychology speaks about, when you have a marriage, one of the most important thing is that closeness, the intimacy part. And often women have experienced discomfort and pain, and that really where you're not able to meet one another's needs. So let's talk a little bit about that intercourse. And let's talk about how pelvic health can improve that quality of life in all aspects.
So intercourse there's a Dr. Rachel Rubin, who is a sexual medicine doctor, and she has a quote that I have absolutely loved and incorporated, which is, sex is a high contact sport, right? And it really just does require a whole recipe to be successful. And I would say that pain with intercourse is one of the most common things that we treat in our practice, and that happens to all women. And I would say there's 3 main pieces of it. One, which is more like the superficial pain, which kind of feels like potentially skin dryness, right? After you have a baby or when you're in menopause, perimenopause, you get a decline in estrogen and other hormones, and that there's so many estrogen receptors down there that the tissue down there is more likely to get dry, right? And with intercourse, it's like going down a water slide without water. You need that area to be lubricated. So that's already part of the equation. Is it just dry skin, or does it kind of hurt a little bit deeper? And that could be more of muscles tightening. For example, we know that a lot of times women are too tight down there. And this is another huge misconception, right? What exactly is happening? It's not just weakness, it's tightness. And that to me is a big, huge light bulb. I hope people are listening going, wow, like I didn't realize pelvic floors can be too tight. I thought we only had to do Kegels to get it tighter. And so the people in our practice have pelvic floors that are too tight. Kind of a big deal.
Sounds like a big deal because I've only heard about Kegels. And I know when I was pregnant, my gynecologist said, it's going to be really important for you to do these Kegels. And then sometimes you don't even know what you're doing and how to do them right. So
correct.
Let's get into that a little bit and share.
We're going to get into Kegels. Yes. Yeah. So Kegels. It has really been used, in my opinion, as just a complete throwaway term for women as any panacea for any vagina problem. And it's kind of just like, oh yeah, do Kegels, which is absurd because you can't even see Kegels, right? Like if I do a bicep curl, I can see my arm. The pelvic floor is a little bit more mysterious. What is going on down there? And in fact, research shows that half the women are doing Kegels incorrectly because no one's really evaluated how that they're doing it. And I see it all the time in the practice because we call it paradoxical. Somebody thinks they're squeezing and they're actually pushing down. So again, I don't think it's adequate healthcare. Telling a woman to do Kegels is not enough for us. So what does that mean? A pelvic floor, just like any other muscle group, needs to be able to contract and relax. Now, what that means is sometimes a pelvic floor can be what I call just on vacation, right? It's not really online. It doesn't know how to react when you're asking it to squeeze. And conversely, the pelvic floor can be too tight and gripped. Think of like a hand stuck in a grip position, or your PMJ patient or neck pain. That muscle group is gripped. The pelvic floor is a really easy place to hold tension. There's even a whole other category called vaginismus, which a lot of women suffer from and not a lot of the general public knows about. And that is basically, vaginismus is, I am ready to have intercourse. They're ready to have penetration. And the vagina or pelvic floor says, nope, not today. And they literally can't because the muscles are in a spasm position. You can imagine how frustrating that is. You can imagine how hard that is sometimes to consummate a marriage or to want to have a child. So this is a major deal. So breaking this open about Kegels as not the answer, but what is going on? Am I too tight? Am I too loose? How is the coordination of my pelvic floor?
What you just brought up, it's almost like, your knee's injured and you actually go to to get a facial. Often we are misdiagnosing situations that happen to women with mental health. Maybe you're so stressed. Maybe there's something wrong with you. Maybe there is trauma. However, there could be a variety of things. So we can't really assume what might be going on, but getting a specialized opinion is a better way to go to have a long-term health that will help us to remain sane and to have that mental capacity where you're not thinking as a woman that there's something wrong with you. Perhaps a part of your body, there's something that's not aligned, and with this support, we can get the help that's necessary. And you mentioned something earlier about bowel health and pelvic pain. How are they associated? Because we're sort of going down that different paths. And the bowel health, I don't get it. Like, how could that be related to pelvic health?
As I sort of mentioned earlier, the vagina and rectum, right, and uterus and like anus, they're all in a very similar sort of tight spot down there. And so there's a direct impact on bowel health and pelvic floor health. You can imagine if you think of it like a pressure system, right? It's kind of the plumbing of the body. It is the plumbing of the body, right? And if you, let's say, become constipated, which is a major issue, for example, in this country, if your bowels are impacted, that puts pressure on top of your bladder and the pelvic floor muscles. Already that becomes a problem because now you've added weight to that delicate hammock-like muscles. And then if you are somebody that has to strain when having a bowel movement, you can just almost imagine now from your pelvic floor muscles perspective, if I am getting beared down and straining every day or many times year after year, that really creates an unhappy environment for those muscles. And that leads to something often known as prolapse, which is like a heaviness or falling or organs sort of kind of coming out in the more extreme cases. And so learning how that bowel and keeping, your gut happy and your bowels healthy and how to have a bowel movement, which is really relaxing and not holding your breath and bearing down, is really creating a much happier environment for those pelvic floor muscles. So that is kind of like in a nutshell how bowels and bladder really are tied together. And so it's really important to have everything be healthy down there.
The key point I'm taking away here is instead of straining in either bowel or urination, it's just to kind of keeping it calm, breathing in and out. How often nowadays we're working from home or we're working, managing 50 million tasks, and having to use the bathroom is where we give the shortest amount of time, right? We give this timeline of like, I just got a minute to go and use the restroom and I got to get back. And I have a feeling that's where we are training our bodies to just basically strain, push, complete, urinating or not, you have to get to the other task. But we don't do that when it comes to a lot of other things, when we're giving to others, when we're taking care of our child, when we're trying to read a book to them at night. But this few moments during the day, and it seems like we don't have to go often and holding for a while. But I can't believe that I'm saying this, but nowadays we're going to have to even create mindfulness in when we have to let go of some parts of our body and, just basically having bowel movement or urination. We have to carve out time. It's just crazy to me, but this is where we're going, and mindfulness in variety of areas. And I'm blown away by this conversation that this is not what we're having the time.
I think awareness is key. And I think in understanding, one of the first questions we ask is, how are your bowel movements? Because it has a direct effect on your pelvic floor muscles. And it's an easy place to start getting on top of constipation and improving gut and bowel health. So directly connected.
So talking about perimenopause now as women. So when can perimenopause sneak up on you, and how does it help or challenge some of our health that's associated with pelvic floor and variety of other changes that are happening in our body?
Yeah, so I'm really glad you brought this up, because perimenopause and menopause is, again, a huge milestone in a woman's life. And I would say just recently, in the last few years, it has changed. I think the awareness, and it's really menopause is having a moment right now. And I'm really excited that it is, because the science that happened about 20 years ago, the PR is that it's scary and that it creates or causes breast cancer or heart disease. There's just a lot of misinformation and scary feelings out there around hormone replacement therapy and when it happens and what it is. And let's start talking about it and breaking this down right now. But essentially, perimenopause is the period of life in which your body starts to change. It's considered a second puberty or a second spring now, which is, I like that term even more. And that is when your hormones in a woman's life really start to change. And I actually want to say, for the most part, estrogen plummets, which is very different than a man who, when they kind of have their menopause, it is just a very shallow decrease, which is ours. And I'm like, if you were watching me right now, I'm showing it's like a cliff, right? Going off the hill. And in fact, there's a bunch other hormone changes that happens as well with progesterone and testosterone. And it's called the zone of hormonal chaos. And what's interesting about perimenopause is one could argue it's more important than menopause, which is actually, menopause is one day in your life. It's a point in time. It is 12 consecutive months of not having a period. Then that day comes, that's menopause, and the next day you're postmenopausal. So really, perimenopause is where all the action is happening and where we need to be more aware and how not to suffer. And then to also be aware of all of the new research that has come out, which has really shown that hormone replacement therapy, the way it's given today, is the gold treatment. No woman should be suffering. And what I want women to know now is to educate themselves I can provide a whole list, and you can put this in the chat comments or the notes area, where the science has changed and there's no more scary feelings about even estrogen cream. Let's say, so what's more common than hot flashes is actually dry vagina. I'm just going to throw it out there. So 80% of women have irritation, dryness down there, and an estrogen cream is 100% safe. And not enough women know about that, right? And it turns out now that estrogen, think of it almost like a gas tank. And who wants to drive without any gas in the gas tank? And estrogen therapy now, which is, it used to be given in a pill form, and now it's actually more like subdermal. So it's either as a patch or a gel or a cream. And it has been life-changing. And it turns out that perimenopause, so the average age of menopause, which we just talked about, is 1 day. And that's 51 years old, right? That's the average age. But symptoms can be developed up to 10 years earlier, a decade beforehand. And these symptoms, oh my goodness, there's 100 of them. And a lot of times, like you kind of mentioned this, we've been mislabeling it. We've been misdiagnosing it. I'm having anxiety or stress. Let's give you an SSRI. When it turns out it might have just been a hormonal imbalance. And we talked about dry vagina or painful intercourse, GSM, the genitourinary symptoms of menopause, and that's urinary tract infections and urge incontinence. Hormone balance is key. And for a lot of times, we used to think, oh, you need a blood test to diagnose it. But it's actually not the case, because every day your blood hormones will be different because it's based on a cycle. So it's not really typically the best way to diagnose it. It's typically based on your age, right? So we talked about it, the average age is 51. You can have symptoms definitely as early as 41. But if your menopause is 45, then 35, you could potentially be in perimenopause, which is a kind of another mind-blowing number. And the key with all of this information is that you just want to go to somebody who is a menopause specialist or who is up to date in menopause research, because in medicine, it takes about 18 to 20 years from when new research comes out for it to become the standard of care. And that's key information, because a lot of times practitioners out there are just going to reflexively give you old information when the science has changed. So my PSA to all women out there is to educate yourself. And again, go back to those notes that Yogi Patel is going to give you, and also to go to somebody who is menopause knowledgeable. Because again, we could talk about perimenopause and menopause for multiple hours, but that I would say is the key information that I want people to walk away with.
Thank you, Dr. Goodrich. You are listening to Now What Podcast with Yogi Patel. If you like the content that you've heard so far, don't forget to follow, and please look at the description for all the details Dr. Goodrich has spoken about. And continuing on, one thing that you said, Dr. Goodrich, is perimenopause. So you could start at 35 and the symptoms. I had no idea that it can just vary, and then that 1 year mark of not having a period, and then that next day you are now finishes post-menopause.
Yeah.
These small terms, this is just one small conversation, less than an hour we've spent together. We've learned so much about women's health, pelvic floor, strengthening it. One of the things that I wonder about is, you mentioned having a specialist that you can visit about perimenopause or menopause. Is this a gynecologist? Who is the specialist that we would go to that would help us understand where we are in our stage of development or phases of life?
I would say that's even a good point. Like, who do I go to, right? Like, where am I in all of this? And I would say that most people will typically talk to their OB-GYN or their primary care physician, which is a pretty darn great place to start. But again, I just want to make sure that those providers are up to date. And what's very cool and interesting is that I live in Silicon Valley, and I feel like Silicon Valley actually has done a nice job of sort of filling the gap in this area. There's a lot of menopause tech-based companies now that have filled this gap of basically women who are like, I'm not getting the help that I need. And so there are multiple companies, and I am going to list them because I am also a clinical advisor to Evernow, which is one of them, which basically has medical doctors and, nurses that you can get a one-on-one telehealth appointment and get a prescription for what you need, because everybody is up to date on this current information. So another great one of them is MIDI Health, which also takes insurance. Evernow, the company that I work with, is subscription-based model. So you get a lot of support and you get to talk to a lot of other women, and there's just many other aspects. They're now including monthly the estrogen cream that I was mentioning because it's so important and so underused. So I would say the key is no matter who you go to, and it could be a nurse practitioner, it could be a primary care physician, they just need to be menopause knowledgeable.
One of the questions I have now, as I am getting younger each day and my body is changing, osteoporosis. You mentioned that some of these products that are out there that can help us with balancing our hormones. Yeah. One of the biggest things that I've heard recently for myself from my physician was, hey, by the age of 60, you want to be off of it because there is osteoporosis. There are other challenges that women can face. Give us facts about osteoporosis. And I have seen people who've had osteopenia or osteoporosis. And then that means basically you're so fragile and you're going to get injured and we stop working out. Like, that is a huge topic. So let's talk and give us anything and everything that you have about aging, hormones, osteoporosis.
I am so thrilled to be talking about this because this is very dear to my heart. I feel like osteoporosis does not get enough attention. And I'm going to blow you away with some very important statistics and facts right now. And again, it kind of blew me away. And I'm a medical care provider, and I didn't even realize this until I really poured myself into this research about 5 years ago. But like osteoporosis, and I'm like being dramatic with these pauses because it really is this important, is 100% preventable. And I don't think, whenever I bring this up, people do not know this. It's shocking. And again, this falls into more of a woman's health category. And again, I think it's been misdiagnosed and mistreated. But 1 out of 2 women will end up with an osteoporotic fracture. That is 50% of us. That's insane. And it is totally preventable. So basically, bone is living tissue, right? It is bone growth. It needs impact. And it's all tied together because estrogen, as we talked about, we have that plummet of estrogen that happens to us. Women, when we go through that menopause changes, it significantly affects our bone health because of that plunge in estrogen. So by being on hormone replacement therapy, that's going to help us a ton. And then also diet and exercise and bone impact is super important, as well as keeping your muscles strong and lifting weights is key because muscles are such a big bone supporter. And so, yeah, osteoporosis is not only preventable, but it's also somewhat reversible. So I don't want people to be scared, but I do want people to be on top of this. And I want women to start to get DEXA scans earlier so that they can start to have a direct clinical data that they can see where they are and then how to improve it and stay ahead of that curve. But women need to be exercising. They need to be jumping. And now I bring up jumping, right? Because it's so helpful. But if you're leaking because you jump, do you want to jump? No. So it's all tied together for me. And so I know that I'm going off rambling, but feel free to ask me more questions about this. But this is really, really important to me. Osteoporosis. In fact, there's a group in the UK called Sticks and Stones, and it's a group of doctors, and they want to eradicate osteoporosis by 2044, I believe. That's like polio, like eradicate it. It's what it should be. And it's very important to me.
So many celebrations for women. And
yes,
our past and the future are going to be so different. We're moving from shame to encouragement. And
love that.
Minus to felt plus, as we say, right? So often, so many things for women, we just brush it off to being a woman. Yeah, it's a complicated system, but so is being a man or any human being, right? I think one of the factors that you spoke about is osteoporosis. I mean, this is a first one for me, that it is reversible. And then there's going to be a possible way for us not to have to worry, or people are going to say, what is that in 50, 80 years from now? So our children will not have to deal with this. But in the meanwhile, you've given us great tools on what we can do when we have questions. What are some of the facts, especially with frequent urination or straining bowel movements, and how everything is connected? And I'll take a photo from you, and we will be able to include that in the video as well. Dr. Goodrich, what other wisdom can you share with women who are younger and not having a baby yet, but perhaps they are going to one day have a baby? Because I was always told, start doing your Kegels now, so that when you are pregnant and begin to have a baby, it's going to help you with frequent urination.
Yeah, so I would say that prevention is key, right? Knowledge is power. So I would say that early on, I want people to know about where their pelvic floor is, how it connects to the core, what the pelvic floor and core should be doing during pregnancy. Because a lot of times I think people think, oh, it's just, everything's just supposed to do whatever it wants to do, and I'll just sit back and sort of observe. But we actually want to keep the pelvic floor and core strong. And I would say, I know I'm going to kind of repeat myself, but seeing a pelvic floor physical therapist is a great way to start, because they're going to be able to individually assess you and then also prepare you for the role of the pelvic floor during labor and delivery. Because I think that kind of gets pushed to the wayside. I would still say that a lot of people think that, pushing, holding your breath, having a baby is the standard, when really it's great, potentially the physics of having a baby, but your pelvic floor does not love that, right? Because now it's getting thrown with so much pressure at it. So what is the role of the core and pelvic floor during labor and delivery? How can you be prepared in that regard? I would say not to be scared and not to sort of be gaslit sometimes with the whole everything is normalized, or back pain during pregnancy is normal. I would say that it's common, but how do I make it better? How do I fix it? I see a lot of women who have had a lot of just pelvic pain, back pain, hip pain for too long. And I want people to be seen earlier rather than later, so that there's no suffering. So that's the long-winded answer.
I love it. So if you like the content of this podcast, and if you learn something new about pelvic floor or menopause or anything of that matter, don't forget to follow and write to us. Let us know what worked for you, or any questions that you might have, and we can get Dr. Goodrich to support us with some of these answers. Dr. Goodrich, you said something about things get the backache, the muscle pains. Tell me, because I think that's where I sometimes think I'm going to stop working out, maybe because my back's hurting, but maybe it has nothing to do with my back. Maybe it's something else.
Again, I would say that your back and your hip and your pelvis, they're all really connected. And so I think a lot of times when someone's had chronic back pain for a long time, a lot of times it's the pelvic floor, because that pelvic floor, those floor muscles attach to the coccyx or your tailbone, and that is part of your spine. So a lot of times it's the missing puzzle in a piece that needed some attention. So if you're having sitting pain or back pain, or I would say try not to just ignore it, especially if it's a recurring problem. Seeing the correct provider to really kind of solve that problem and help you get on the right track is, I would say, the way to go.
Absolutely wise choices. We have been really self-diagnosing and trying remedies from what our parents have told us or what we have seen others do. And at my gym, thanks to Susan, I learned about pelvic floor therapy, and she said, I am cured, thank goodness, after having twins. And she had met you in this Bay Area. I said, what is this pelvic floor thing that you're talking about? Because I keep complaining about often my lower back, and I'm gingerly with some weights, certain exercises. And she said, are you sure? And that's why I wanted to bring that up, because often we don't visit the doctors that when we need to. Often we become Google doctors, and having this types of information is hopefully empowering, encouraging, because all we can do is take care of ourselves. We are advocates of our bodies. And thanks to Dr. Goodrich today, we have a few more tools in our toolbox to be able to take care of ourselves so we can take care of our children, our spouse, our community. If you're a teacher, the whole classroom, you have to be in that classroom. You can't leave. So hopefully this podcast has brought you some more information in how you can take care of yourself, little ones at home, and share this information with others. You're listening to Now What podcast with Yogi Patel. Our guest is Dr. Goodrich, and she specializes in pelvic floor therapy and much more. She's an advocate, and you can definitely visit her website for more information. Thank you for joining in. And until next time, see you later. I'm Yogi Patel. If you like the content of this video, please don't forget to follow. And also, if you want more information, visit the website, yogipateltte.com.